Good afternoon, everybody. It's good to be back home, he said, lying through his teeth after the wonderful time I had over in Seville. First time I've ever been, really. Well, second time, but the first time round you couldn't really count because I only went about 10 yards in. Went for a drink, went back home. But this time round, the week, it was just the best, really, the best. And now back to earth with a bump. Right then. Let's go through it. A nice big juicy mailbag, the discussion board this week. Pat E. Thanks for the contribution there, Pat. Describing big lumpy bits of fat getting pulled out of people's carotid arteries. It's the thing that always amazes me about carotid endarterectomy is how is it that big raw edge on the inside of the carotid artery, how come that doesn't scab over or clot over or something or other? It seems such an insult to the inside of the vessel to pull something that adhesive off that you just wonder, how do people ever survive it, But people seem to do okay, and once you've gone under the plaque, then it seems to leave a healthy tissue, a healthy lining, a healthy inner lining to the blood vessel, And here is another thing as well. All these things now can be treated through an endovascular approach. It's almost as though we're reaching the end of surgery, isn't it, in this? When this module started, it was very much aimed at, sewing two bits of blood vessel back together again and forming a nice tight seal. Whereas these days, it seems to be that everything's being done either from the patient's radius or from the femoral artery, It's a strange business to watch as medical practice kind of changes in front of your very eyes. Karen H, thank you, Karen. Yes, she's only seen one case of thoracic outlet syndrome, and that was on a young woman. I wonder if I can't remember this from Mr. Joseph's presentation, but I wonder if it is more common in women than men. Surprise, surprise, I found two women who were prepared to sit down and talk to me about their problems in this area. I wonder if it is more common. I only ever saw one of these in theatre when I was a theatre nurse. I think I only ever saw one of them. And I can't remember any of the details, except that it looked very uncomfortable. There was that side to it. It did look like a procedure that you were going to take some recovering from. Now, Pat's answered the question that I asked. Do you think that if you focus on one particular aspect of a person's body, that you can go about claiming the fact that you're holistic? And in a way that this question was inspired by discussions I once had with a French nurse. And I asked her if in France were there for any intensive care nurse training courses, and she said no. Well, in France, she said, we consider that would be repeating the mistakes that have been made by the medical profession. In that, the more that you specialise down, the more you reduce everything to one particular part of the body or one particular technique, the more you compromise nursing's claim to be more general in its view, that we aren't just interested in the head or the heart or the blood vessels, we are interested in the whole thing. And that led me to doubt, really. I wonder if you can claim, if you're a neuro nurse, why would you look further down? And also, I often think that the word holistic means good. It's just another word for good. Yeah, that is to say, I can think of good medical care, good nursing care, but I can't think of bad holistic care. Um, well, I can think of good medical care and bad medical care. I can't think of bad holistic care because that seems to contradict the word holistic, if you see what I mean. I think that when we talk about care which is offered to patients which is non holistic, I think that what people are really saying is number one, it's not given by me, and number two, it's rubbish. I think that's what it kind of means, really. I've yet to come across a settled definition of what holistic care is, really. Um, or rather, I have never ever heard somebody say what you should concentrate on is just the organ and never pay any attention to the spiritual, emotional, social, other effects of the disease or the disease's treatments. I've never come across someone who says that. Not being holistic is always something that someone accuses somebody else of. And yet, I don't really understand what it means, to be honest with you. I don't. And so, naturally enough, Pat doesn't think that concentrating on but one particular organ in the body compromises the claim to be holistic at all. And I say you, Pat, but everybody else that's ever asked this question, um, that's ever answered this question has said precisely the same thing. It's a very unpopular thing to say to people, that perhaps your care is not holistic. And yet, if you ask someone to define what holistic was, they'd be often pushed to say what it is. Um, but, what else? What else has come through? Pat A, yes, Pat A again, talking about delusional beliefs. You knew someone who this happened to, was it, Pat? Somebody who'd been in intensive care for a while. I knew a fella. In fact, he was one of my colleagues here in the faculty who came off his motorbike one day on the way home, and he said for the majority of time that he was in intensive care, every single time there was a ward round, he felt that there was a full-on demon on the ward round, plotting his downfall. A monster on the ward round. Can you imagine that? And it's by no means clear where these delusions come from. Is it the drugs that people are given? They are pretty psychoactive. They keep you asleep after all. Is it the psychological trauma that you've been through that's taking you to intensive care? Which psychological trauma of any type will produce flashbacks and produce nightmares, won't it? Is it hypoxia, for instance? You're on a ventilator, so you must have run short of oxygen at some point. Is that done sort of diffuse brain? Nobody quite knows what it is that's caused this. But when I was in practice, one of my junior staff nurses, she announced that she was going to be going off to a local intensive care unit to be a research assistant, looking into the psychological effects of intensive care, and she's made a career out of this woman. In fact, what I'm going to try and do is find one of her papers and put it up on this broadcast. But that's a strange one, isn't it, Pat? That your legs had been taken off and someone else has sewn on. That's the strangest, But it's not the strangest I've heard of. I'll put this paper up and see what you think. And sometimes these delusions that people get are incredibly difficult to shift. The person defends their delusion, if you know what I mean. They might see that it doesn't add up logically, but nevertheless, it has a strength in their thinking that they can't deny. One of them, and this is the subject of the paper that I'm going to put up, is Capgras delusion. The idea that your family and friends may look like your family and friends, but it's not really them. They are imposters. Diane, your uncle survived survived a ruptured aneurysm. That's interesting. Email me separately, Diane, and see if your poor uncle would like to sit down and have a chat with me, because that would be an interesting story to get if he doesn't live too far away. Maybe I could come and visit him and record his story if you wouldn't mind. Another person who survived a leaking aneurysm. I don't know whether you knew this fella, but there was a famous journalist once called Paul Foote. He ended up on the wrong end of a leaking aneurysm, and when they went in and opened him up, it's a terrifying business. I might have mentioned this before last week. It is a terrifying business to see someone's abdomen just fill up with blood, and it doesn't really your panic doesn't really subside until the surgeon puts the clamp on and clamps off the aorta. But in Paul Foote's case, what they also clamped off was a vertebral artery. So he lost all blood supply to his spinal cord below the level of the clamps. And of course, he only had 3 or 4 minutes then, and his nerve damage started to take place. And although he survived the procedure, he'd lost completely the use of his legs, and that was it really for him. I mean, he lasted a few years afterwards, but even so, And the man, even given that, the man was full of praise and full of gratitude for the surgeon that saved his life. Sometimes you wonder whether these things are in the eye of the beholder, don't you? And Julie M said that she's never seen a patient refuse an aneurysm repair. Yeah. Well, I think I dealt with this last time. I only ever saw one. And there was a man who I still remember him now with admiration. The stoical way in which he just said, "Nah, my time's up," and that's it. Right, the other one I want to talk to you about is Michelle's, who's raised a question there about where am I? I'm just trying to find it. Exercise, and she's all confused. And there's not much I can say to help you here, Michelle. This is not really a subject. Exercise and atherogenesis it's not really something I'm very boned up on. But firstly, nitric oxide. I know a bit about that. And you say, why don't they give this stuff IV? Well, they do give it IV. They do give nitric oxide IV. When a person goes into hospital with chest pain, for instance, if they are put on a nitrate infusion, a GTN infusion, glyceryl trinitrate, there's the idea there. Glyceryl trinitrate. What that does is when it gets into your bloodstream, it starts to donate nitric oxide, and therefore it causes your blood vessels to relax. And when it causes your blood vessels to relax, so you get increased coronary artery perfusion and decreased myocardial oxygen demand. And so therefore, the chest pain that you're suffering goes down. Now, in the fullness of time, all this nitric oxide is washed away by an enzyme in your blood vessels called, what's it called now? I can't remember. It's an enzyme anyway, and that gets washed away. And what they've developed, or what Pfizer were developing at least, was a drug that would block the effect of the nitric oxide enzyme, block its effect, allow nitric oxide to build up, and therefore get vasodilatation and a reduction in blood pressure and increased tissue perfusion and all that sort of thing. But of course, this drug, the enzyme blocker, is what eventually became Viagra. It was discovered entirely by accident as a side effect of this drug, which they hoped was going to be an antihypertensive. Because you're blocking with Viagra the enzyme which washes away nitric oxide, that's why you can't take GTN alongside Viagra, because if you do, the nitric oxide that comes from the GTN will be entirely unopposed in your blood vessels, and it will build up and up and up until you get a catastrophic drop in blood pressure and you lose consciousness. That's the theory. I've never actually heard of anybody losing consciousness who's combined the two, but that's the theory, and that's why it's contraindicated. I could do with a lie down now. So you also ask, why does exercise reduce insulin resistance? And there's another question that I can't answer. But there's a further twist to this. My stepdaughter is diabetic, and she tells me that and she's a full-on type 1 diabetic, has been since she was 13. And she tells me that if she exercises, if she indulges in heavy exercise, her requirement for insulin goes right down. I wonder why. Why should it be? Why should it be that if you exercise and you're type 1 diabetic, that you should need less in the way of insulin? You could almost understand it more if your requirement for insulin went up. But she says that she can really economise on her insulin by taking more exercise. I fail to understand that. Why does in type 2 diabetes, you ask, I just don't understand why this should make those faulty receptor sites stop being faulty. Is there anything I should read? Yes, everything, because I don't understand it either. If you find out, you let us know. For your last question, Michelle, should you go out and exercise? Yes, absolutely. I wouldn't say run, but I'm chronic anti-jogger, but certainly a brisk walk every night after dinner won't do you any harm. I've not actually had a look where we're up to yet, but I'm wondering if we've spoken to Eddie Caldo yet, because I'm going to be, so at some point in the course, I can't remember whether it's this week or not, Eddie Caldo, who's an exercise physiologist. If you have a question for Eddie, then why don't you send it to me and I'll forward it on to him? What about that? Anyway, it's jolly good to be back, he said once more, lying through his teeth. There's 15 minutes now. Good to hear from you all again. Nice to hear that you're all active. Pat asked me something else on email, and I can't quite remember what it is now, but I'm sure I've replied to it on email, Pat. So, adios amigos. Hasta la vista.